Assalamualaikum and hi to Dr. Hassan and my fellow friends. Today Group 2 will present about Standard Operating Procedure SOP. So in our presentation, we will touch about the background, the need innovation and change management, the innovative solution to improve performance, and lastly about the lead and manage change.
My name is Liao Ziyan. Now I will present about the background of COVID-19. There are three effects that COVID-19 brings to organization day-to-day activities, which is numerous business dying out, the whole food system and the economy, labor market and workers. First is the numerous businesses are in danger of dying out. Workers in the informal economy are particularly vulnerable because the majority do not have access to social safety, high quality healthcare or productive assets. Many people are unable to provide for themselves and their families during lockdowns because they lack the means of earning a living. Second is the epidemic has been having an impact on the whole food system and exports in availability. Border closure, trade resistance, and confinement measures have made it difficult for farmers to access market, buy inputs and sell their product, and for agriculture workers to harvest crops. As a result, domestic and global food supply chain have been disrupted, and the availability of the variety of safe, healthy diets have decreased. Besides that, the COVID-19 dilemma have negatively affected the economy, labor market and workers in Malaysia. Measure of labor market slack hit their highest level in decades. And despite easing mobility constraints, the headline and employment rate is still at multi-decade highs. The background of COVID-19. COVID-19, also known as coronavirus disease 2019, is brought on by a novel coronavirus called severe acute respiratory syndrome coronavirus 2. And COVID-19 is discovered in Wuhan City, Hubei Province, China. On December 31, 2019, it was initially reported to the WHO. The WHO labeled the COVID-19 outbreak a worldwide health emergency on January 13, 2020.
Hi, my name is Imelda. Next, I will present about need for innovation and change management. Firstly, the importance of innovation for our organization is leading innovation. Leading innovation is work atmosphere that prioritizes employee creativity over meeting deadlines and making money. Since the technology sector is ever changing and produce new ideas, technology organizations frequently have a creative culture. Besides, integrating innovation and business strategies. Integrating innovation and business strategies is more about aligning an organization's goal, vision, and value. Provision for specific target market, that it is about employing innovation strategies such as hosting an idea competition. On the other hand, creating and culturing value. When a decision is made for which the benefit outweigh the cost, or when decision is prohibited for which the cost outweigh the benefits, value is produced. This holds true for a few production-related factors including quality, quantity, entry, innovation, and production method. Job safety also refers to interaction between a company and its employees. Lastly, weaving innovation into the fabric of business. Medical and technological advice have significantly impacted both individuals and societies. No one can dispute the significance and innovation of this broad innovation.
Hi, Assalamualaikum. My name is Farid Zaifri bin Mat Zaini, and now I will present about innovative solution to improve performance. Now we go to the innovative solution to improve the performance. Various techniques are used to generate innovative options to deliver identify improvements, such as think about the customer, utilization of human resource, and also using the technology. So, think about the customer. What the organization need to do? Organization need to ensure what people need. They can use various methods to get feedback from the customer, such as the comment on social media or questionnaire from user. For the utilization of human resource, the HR department helps organization to shape the new strategies and also recruit the new employee who can contribute to innovation. And the last is using the technology. By working with technology expert from different fields, leader can gain a new idea to reduce costs, improve product, and provide quality customer service.
So for this part, we specific about option for generating the purpose improvement evaluate to determine feasibility and viability. So for innovative solution, there are three parts that we study. First, we're talking about working and scrutiny of quality improvement. Second, about data measuring, and lastly, about the implementation of education. For working and scrutiny for quality improvement, we know that when the COVID-19 pandemic started, the quality of improvement committee in hospital organization and role were improved. So from that, quality committee is across the organization, especially for hospital, with the specialist knowledge and addition required to carry about a new activity from this pandemic. So to improve this situation, the hospital develop a different procedure and paper which can circulated through the institution after being reviewed and approved by representative. So the quality committee will able to harmonize organization and workflow across the many institute and offer up-to-date recommendation based on the more recent best practice. Thanks to this newly procedure, protocol and documentation from hospital. Next, for data measuring. Data on patient safety and quality must be reported for both COVID-19 related and unrelated incidents. So, although collecting information for in-person assessment, such as adhering to hygiene or checklist, this may require a different mechanism to evaluate pre-existing quality like serious injury incident rate. Lastly, the implementation of education. So for this part, we all know that the COVID-19 pandemic present a situation and clinical issue. So from the hospital clinical side, a web-based COVID-19 toolkit with a quick link to detection technique, PPE recommendation, preventative measure, care consideration, and numerous other instructional and sectional data is readily available.
Assalamualaikum, my name is Hijrah Hibzi bin Ahmad Jamal. These are a few ways to lead and manage in this topic. Firstly, you have to agree by the strategy that has been implemented by committing the methods or techniques used so that it will enhance the adoption and sustainability. Moreover, time frame should be followed and we need to draw up a implementation plan so that we must set up a team, a change so that we can work in a team rather than work alone. This will establish a good progression on the program. By establishing a group, we can communicate and work a lot more easier and also a lot more